Okay, so I think we should start now. Uh, okay, so I think all of you know about my introduction. So the module of today is one of the modules you will be needing in your future practice, and if you understand what is diet after bariatric surgery and what is the difference between your weight loss diet and a bariatric surgery diet and a Allurian balloon diet, then you will become the par excellence or the excellent dietitian as you all want to become. So before I start the phases of phases of diet after bariatric surgery, there are general principles which have to be followed. So always remember that a bariatric surgery patient is like a newborn baby. Just remember the newborn baby when you are prescribing them the diet. So how does a newborn baby eats or drinks food? So once a baby is formed, a baby is born. So the baby is usually taking sips of liquid initially. After that, slowly and slowly it goes on to the pureed diet and slowly goes on to the full diet. This is how a bariatric surgery patient behaves as well. So they have to basically start sipping 50 to 100 ml per hour of liquid, and it has to be done very slowly. It has to be done over a period of hour, and they have to stop water intake 30 liquid or liquid intake 30 minutes before and after a meal in their phase 3 and phase 4 diet. Also, they should not use a straw because if they use a straw, air will go inside the stomach and they will feel full and they won't be able to drink or eat as they should eat or drink. So do not use a straw. Stop liquids 30 minutes before and after the meal. And when you start in phase 1 and phase 2 diet, it should be sip by sip like a newborn baby. They should avoid all carbonated beverages because they produce air and it can cause discomfort. You have to understand in your mind that the size of the stomach is small in a bariatric surgery patient. In a sleeve gastrectomy, as we have told you in the last class, the stomach is like a banana. In a bypass patient is a small tube which is connected to the intestine 2 meter below. And once we are comfortable, we start some supplements because they are already deficient in vitamin D and B12, and they have to chew when they are in the phase 3 or phase 4 diet. They have to chew the food properly. It should not go like a bulk or it can obstruct the stroma. And every patient is different. So if they feel full, how they will feel full? There is if there is a if they eat fast or they eat a lot of uh, liquid or a food, they will feel some pressure in the center just below the rib cage or in the chest area. They will be associated nausea or sometimes pain in the shoulder. That means they are eating too fast or they have eaten a lot of meals which is thick. So they have to basically relax, let the food go down. Don't take the next meal unless they feel comfortable. And if the system symptoms don't perish or they keep on persisting for 1 or 2 hours, they need to contact the operating doctor as soon as possible. So in a bariatric phase, there are 4 phases. The 4 phases are clear liquid diet, which is started 24 hours, that is the next day after the surgery, and is there for 2 to 3 days. Then full liquid diet is phase 2, which starts 3 to 4 days after the surgery at the time of discharge, and it is there till 2 to 4 weeks. It is not compulsory to continue full liquid diet on 4 weeks. There are patients, if they have increased their activity, you can start the phase 3 diet at 2 weeks, and there are some patients who may continue liquid diet till 6 weeks. There is no problem at all. The soft or pureed diet will start at uh, 1 month after the procedure, and low fat solid diet, which is a full diet, will start around 2 months after the procedure. This is a general protocol. So, next day after the surgery, a lot of surgeons they do a diet test before they start the diets. I do a diet test during the surgery, and so I start my diet next day morning without a diet test. So just whenever you are taking care of a bariatric patient post-op day one, just talk to your surgeon that if they have a protocol of doing a diet test after the surgery on day one, so wait for the diet test results before starting the liquids. And like myself, where I do the diet test during the surgery itself, you can start the liquids next day morning. It has to be 50 to 100 ml per hour, sip by sip. Initially sips they will feel something in the stomach which is normal because there is a staple line. So the when the fluid is going, they will feel, because there is a raw wound, they will feel something is going through the stomach. And these are very simple things which we can start, like whey water or coconut water is my choice. Coconut water, clear dal water if the patient is non-vegetarian, clear soups, black tea, black coffee, fresh lemon water. These are the things patient can take. So the phase one diet, you have to understand, remains for 2 to 3 days. It has to be, all the liquids have to be thinned out and they have to be strained. So there should be no food particle in it. And if you ask me, my choice is tender coconut water. If you give them apple juices or more, they will start drinking apple juices only. So generally, though I have written apple juice for once in a day, but you should avoid giving apple juice. Better is a clear soup, clear chicken soup, clear dal water, because they are also high in protein content. Then comes the phase two diet. A bariatric surgery patient is discharged over 48 to 72 hours. So once the patient is comfortable, patient has started mobilizing, you can start this full liquid diet at 2 to 3 days, and it continues for 4 weeks, where you can add buttermilk, you can add skimmed milk if the patient is not lactose intolerant. You can add clear juices like before, dal soup, and at that time you can start the protein. My protocol is I start the protein as fast as possible. You can basically give them whey protein in any form, half scoop, 100 ml in the morning, 100 ml in the evening. And this is a sample chart of phase two. Like this, you have to give them daily, on the daily basis, so patient becomes easy for the patient to basically follow. Like a tender coconut water at 7 a.m., 9 a.m. whey protein, 11 a.m. vegetable juice, 1 a.m. whey protein, then buttermilk, chicken soup, whey protein, and buttermilk. The protein is very important. Understand the protein should always be there in the diet, and start from 50 to 100 ml, and you can increase up to 150 ml per hour. But it has to be taken over the hour, not in one gulp. That is very important. Once the patient is comfortable,
I'm
after
happy.
2 weeks, you can start the homemade proteins like this, because now they can take some strained juices as well. If somebody is not able to digest banana, you don't give banana in it. Amir will share this video with you where we use chana powder, which is 30 to 50 grams. You can start with 20 grams, one dates, five raisins, five cashews, five almonds, and half banana, and milk around 100 ml. That will be half of the menu which is here. You can start with that. And in the phase 3 diet, you can give a full bone protein shake where you can use 30 to 50 gram of chana powder, one banana, 250 ml of milk, five cashews, five raisins, five almonds, and some jaggery, 5 gram. This is very high in protein, around 30 grams protein is there. At that time, you can replace homemade protein shake from any outside whey protein. In phase 3 diet, I think this is the protein you should ask all your patients to take. When you come to phase 3 diet, which is a semi-solid diet after 1 month of the procedure, remember this very important thing, that you have to add one food at a time, and you have to aim is to give 4 to 6 small meals in a day, no heavy meals, and very important, no liquids 30 minutes before the meal and 30 minutes after the meal, because the stomach pouch will be filled by liquid, then the patient will not be able to eat much. So you can start anything, like small khichdi, some dalia, some porridge, oats. Uh, and if a patient is a non-vegetarian, you can give them boiled chicken, some fish, and all the fruits should be de-seeded and peeled. We are not planning to give them high fiber again, because the stomach can be blocked. And these are the things you can allow. And that time the protein replacement is always homemade protein. It should not be whey protein can be replaced by the homemade protein. I already showed you the video. This is a sample chart for that time. Homemade protein shake, then you can give them some muesli, juice, khichdi, buttermilk, chicken soup, and buttermilk in the end. Idea is that it should be high protein. If there is high protein, patient will be full. They will not snack in a wrong way. If the patient is not taking protein, whenever they will feel hungry, they will snack, because they are eating less. So they will start eating bhujiyas and all those things again, which are high calorie. And because of that, the weight loss will not be as expected. I suggest you give a patient a different chart every day, and in a phase 3 you can give them a weekly chart, so they know which day which things to eat. Like one day they will take muesli, another day they will take oats, third day they will take dalia. You can give different choices on different days. When you come to the phase 4 diet, which is a regular diet approximately 8 weeks after the surgery, just general rule, maintain a low fat, low sugar diet. Those who have given me the charts, like around 1200 to 1500 calories and 80 to 90 gram protein, is the chart which has to be used at that period of time. So that is the chart which has to be used. Those who have made those charts, they will be having no difficulty in treating that patients. Remember, there are 32 teeth. The patient has to chew 32 times. You tell them to chew 32 times. At least they will do 10 to 12 times before taking the meal. So the once it is chewed properly, it will become pureed, and there will be no problem digesting it easily. So generally, you can go from step to step. Like when the patient wants to eat roti, they can eat half a roti initially, slowly increase to one roti. Just avoid milk or ghee over it initially. But if they are walking well, you can give them some oil or ghee as well. Then everybody knows how to give dalia, rava, flakes. Besan chila can be given. Paneer sandwich can be given in a whole wheat bread. Idea is high protein, low fat diets, 1200 to 1500 calories and 80 to 90 gram proteins. Avoid this white breads and naan. Again, pulses start from any dal, any pulse can be taken, 2 tablespoons initially and slowly increase. And soya is a very high protein source. You can add soya bean chunks in rice as well as in poha, and that will become a high protein guides as well. For a non-vegetarian group, you can give them egg whites. Avoid omelets because they will have a lot of oil in it, or you can give basically boiled chicken as well. For dairy products, I think over a period of day, take 600 ml. If they take two protein shakes, that will be completing their milk as well, requirement as well. And fruits and vegetable. In places of juices now, they can take any fruit or vegetable. If they are diabetic, you already know which fruits have to be given, and they have to be deseeded and peeled before eating. That is very important. 1 teaspoon, 1 to 2 teaspoon of sugar and 2 to 3 teaspoon of oil is okay if they are doing good activity. If they are not doing regular activity, then avoid, uh, minimize intake of sugar and ghee. And fluid intake is very important. A lot of people complain of constipation after the bariatric surgery because they are not taking enough liquids. 2.5 liters per day is an average, ranging from 2 to 3 liters or 6 to 8 cups. If they drink properly, they will have no constipation, and also they will be hydrated. Dairy products, we have already discussed, and idea is 3 meals and 2 protein snacks per day. So you can give them high protein snacks. In one next presentation, I will teach you what are the high protein snacks we can use for the patients uh, after bariatric surgery, or even patients who have not undergone bariatric surgery. Just aim to give them a negative energy balanced diet for weight loss. Once they've achieved their target, it should be a balanced diet with all the best nutrients, high protein, and 1500 to 2000 calories once they are doing good activity. And important thing is that remember when they feel full. So once they feel full, they have to stop. Sometimes even taking a one chapati, one spoon of this dal, feel full initially, but later on they can eat half a katori easily. So once they feel full, ask them to relax and walk, and then try again. These are the basic protocols. No liquids with meal, no liquids 30 minutes before or 30 minutes after the meals or with the meal. Drink adequate water. Do not gulp liquids, and don't wait lot of time before meals. It should be small, frequent meals. No straw to be used because air will go inside. Avoid beverages uh, which produce this gases in the stomach, like sweetened beverages or alcoholic beverages or carbonated drinks. And the the all the drinks should be taken like coconut water and black tea, black coffee, and green teas. Main thing is healthy nutrition choices, and also activity is very important. At least 30 to 40 minutes per day, 5 times in a week is very important for the best results. and some basic issues can happen. This is a separate module which we will discuss on module 5, but I will give you a overview of it. Sometimes people are afraid that they will get nausea and vomiting after bariatric surgery. It is not true at all. Most of the cases they don't feel any nausea and vomiting unless they are drinking too fast or they are taking carbonated drinks. So just check what they are drinking. Are they drinking as you have told them to drink, or they are drinking too fast, or they are drinking too much at one time? Then only they will feel nausea, otherwise they won't feel any nausea. Dumping syndrome is very rare now. It used to happen in bypass patients where you used to bypass 3 to 4 meters of intestine. Nowadays we bypass only 1.5 to 2 meters, so this is not a problem at all nowadays. If people are having dumping, just check they are taking a lot of sweetened foods, because that causes the sugar level to rise and cause early dumping. And in later cases, once the sugar rises, insulin is produced, the sugar comes down and can produce late dumping 30 minutes after the food. If there is a pain in the shoulder or upper chest area, just see if they are drinking too fast or drinking too much at one time. These are the two most important things. If that is not the case, ask them to contact us immediately, because that can be an early sign of a leak. Dehydration, I know, I already told you. Some people have a habit of taking a lot of caffeine. Caffeine is a diuretic, so small cup of coffee is fine. If they are taking 3 to 4 cups of coffee, they may get dehydrated if they are not drinking too much. So that has to be changed. Lactose intolerance or diarrhea. Some people who are started on proteins or they are given milk-based homemade proteins, they can have diarrhea because they are lactose intolerant. For those patients, you can give soya milk. For constipation, it is necessary to tell constipation after the surgery, patient will pass stools only twice a week because they are on liquid diet. So that counseling has to be done. And also, if they want, you can give them stool softeners like syrup lactulose. That is a separate module which I will explain in detail. For diarrhea, again, check for lactose intolerance. And important thing is change the milk products or give them lactase treated products. Heartburn, same thing. Caffeine, carbonated beverages, using a straw, or basically drinking too fast. Bloating is not a problem nowadays. Some people after bypass have taste or sensory changes. That is an advantage because now there is no favorite food for them. You can change their choices to healthy choices. Blockage of stomach is very rare now because of the diet counseling and the teaching of the patients. They are not taking those, if they are taking high fibers and taking a lot of quantity, sometimes it can happen, but it is very rare nowadays. These are important things. Rupture of staple line, which is very unlikely again nowadays. But if there is any doubt, the danger signs are fever, pain, and increase in pulse rate. This is a separate module, module 5, where I will teach you in detail what are the signs and what you have to do. And stomach dilatation can be there if the patient thinks I have to eat like before. Stomach is like a balloon. They keep on stretching it over the period of years, and sometimes after 5 to 7 years, they can increase the stomach size. It may not return to the normal size, but obviously it can be a cause of a weight gain. So weight gain can be there if the patient is not doing any physical activity. They think bariatric surgery alone will do everything. That is not the case. And basically, if they are start drinking alcohol or they are start eating high calorie foods without doing an activity, is an important cause of weight gain even after bariatric surgery. So I give you always a take home messages. Today I'll give you temptation bundling. Just remember in your weight loss patients as well that always when you are adding a new habit, suppose you want a patient to do walking or you want a patient to eat some healthy food, always tag it something which habit they cannot avoid. Sometimes a patient is a habit, is a routine habit of doing a morning walk. That time add a protein shake to the morning walk. So a new habit is added to already a habit which is established. So you have to ask them their routine protocol over the period of a day. So you understand which habits is there already in their mind and which they are doing it regularly. So when you're adding a new habit, just tag it with the old habit. So it becomes very easy for them to start a new habit. Suppose a patient asks for a diet chart. You give them a completely different diet chart which diet they are taking. They will not follow your diet chart. But if you understand what diet they are taking already, just do minor changes in them. If somebody has a habit of taking a paratha in the morning, change from aloo paratha to a paneer paratha initially. Remove the butter and oil, so the calories are decreasing. Slowly change the paneer paratha to a besan chila. But if you start asking them to take a besan chila from day one, they may not be able to take it. So start changing slowly. If a patient has a habit of taking some high sugar tea in the morning. So ask them to use skimmed milk first. So though they are taking tea, they are using skimmed milk. After them, that ask them to decrease the sugar intake. That is how you can add new habits with the old habits and make it temptation bundling. So just remember that a bariatric surgery patient is a newborn baby. Treat them like a newborn baby. Then you will not be having any problem for their treatment. I always
अगर आपके
want
अंदर
to give
नेगेटिव
you
थॉट्स आ रहे
some mudras
हैं, फील कर रहे हैं अपने
for
पास, उसी वजह से आपका अगर
your
वेट बढ़
study
रहा है,
also
तो
you can
आप
share with your
एक
patients.
मुद्रा करें जिसको
This is a
सेपाना मुद्रा बोलते हैं. बड़ी इजी मुद्रा है. तीनों उंगलियों को ऐसे दबाएं, ये फिंगर अपनी ऊपर की तरफ रखें और थम्स को एक दूसरे के ऊपर लाएं. इस तरह से 10 से 15 सेकंड इस तरह करें, फिर 10 से 15 सेकंड इस तरह करें. अगर आप दिन में इसको 5 से 10 मिनट करते हैं तो डेफिनेटली नेगेटिव एनर्जी और नेगेटिव एनर्जी बढ़ाने वाली चीज़ें या लोग आपसे दूर होना शुरू कर देंगे. सेपाना मुद्रा इसको बोलते हैं. फिर दोबारा से आप देख सकते हैं, इसको आपने इस तरह से करना है, ठीक है. और आप देखेंगे कि नेगेटिव एनर्जी या नेगेटिव लोग आपसे दूर होना शुरू कर देंगे.
weight increase. The most common cause of weight increase is depression or anxiety that may happen because of weight gain, or that can be the cause of weight gain. And so always I try to teach my patients some mudras so they feel that they are removing the negative energies from themselves and they feel positive and they are motivated to follow what you want to teach them. So this is one mudra which I also do and I also enjoy doing it.
अगर आपके अंदर
This is my